So here's my technique. I've made a long incision here. You can do it through 2 small scars, but in my patient population, you don't want to mess it up. So I use a big scar. I palpate the inferior pole of the patella. I incise the paratenon, as you can see. And in athletes, there are usually adhesions between the tendon and the paratenon that need to be divided. The width of the tendon in most human beings is around 30 millimeters, but needless to say, my population is up to 45 because they are special. I palpate the inferior pole, and I want to have the inferior pole at the center of my graft. I make a freehand incision, splitting the fibers, as you can see, and then I measure a graft, and usually I take a 12 millimeter graft because my patients have a very large tendon, and as a result, I'm probably only taking about a quarter of the width. I would never take more than a third of the width of the tendon in smaller patients. I've got to identify the insertion point on the tibia, which I mark, and I'm going to take a 25 millimeter bone block. I pre-drill it with a 2 millimeter drill. If you use a smaller drill, it's often hard to get the sutures through that you're going to need. And then I take a really decent chunk of bone. We use some of that bone later on to bone graft the patella, and that's another way of reducing the risk of fracture, but also anterior knee pain. We're blessed these days with fantastic saws that have got great power. It, again, is so much better than it used to be. So I use a 10 millimeter saw, and on the cut around the 3 sides. And if the bone is very hard, I might use a 5 millimeter saw for this cut on the transverse part. Now, if you've got a very short patellar tendon, I would deliberately increase the length of the bone block to ensure we have adequate length. So we just loosen that up, and then I dissect the tendon off the fat pad. You want to leave the apex of the fat pad intact, otherwise you get very wet throughout the procedure. And again, you just don't want to touch the fat pad. It's full of nerve endings, it's very sensitive, full of stem cells, so it causes scarring. It is the source of all evil, as I said. So here we harvest some of that bone, and that'll be useful later on for grafting. Now, I've done a few of these before, so that's a 10 millimeter bone block, so slightly smaller than my soft tissue width. I now palpate the insertion into the patella and mark that. I want a much shorter block than we used to take. I only take a 20 millimeter bone block. You don't need a big block, and I make it trapezoid shaped, so it's bullet shaped, so it can be passed more easily. And then pre-drill with a single AP drill. And then the next bit is very key. We're going to cut the 3 sides of the trapezoid using a 10 millimeter saw on each side, and then a 5 millimeter one at the top. And I'm only really going through the cortex. We used to take enormous bone blocks, which was unnecessary, and so a nice, neat, small block. So having gone round the bone block, then I elevate the tendon up and I undercut it. I've shown this by Greg Keane in Adelaide. And so you end up taking a very small amount of bone that reduces the risk of fracture and pain. And then take that off the fat pad, as I say, without making a hole in it. And usually the bone block will be 9 or 10 millimeters.